This video will take you through demonstrations of two types of teeth desensitizers, BrushBond and Pain-Free F. BrushBond is a 4-meta-based self-etching, self-priming bonding agent that's ideal for adhesive procedures, protecting tooth structure against micro-leakage, as well as desensitizing teeth. It seals the tubules to prevent sensitivity and protects the vulnerable pulp. Pain-Free's no-mix formula chemically bonds to the calcium in the dentin via chelation. It creates a plastic shield that blocks out external stimuli and eliminates sensitivity. Preparing and applying BrushBond. 1. Clean and dry the working surfaces thoroughly. 2. Holding the bonding liquid bottle vertically, add 1 to 3 drops to the mixing dish. Recap the bottle immediately. 3. To activate the liquid, stir the liquid with a BrushBond activator brush for 2 seconds. These activator brushes are for single use only, containing enough activator for up to 3 drops of bonding liquid. 4. Once activated, apply the BrushBond liquid to the tooth surface within 3 minutes. 5. Ensure the tooth surface remains wet with the BrushBond liquid for 20 seconds. Then gently blow with air for 10 seconds to evaporate the solvents. 6. Using any curing light, cure for 10 seconds. 7. Air test for sensitivity. If needed, repeat the application from step 2. Preparing and applying Pain-Free F. 1. To achieve the most effective desensitization, calculus accretions should be removed before applying Pain-Free by gently scaling the surface. 2. Clean and dry the working surfaces thoroughly. 3. Express 2 drops of Pain-Free F into a dappen dish. As a 1-bottle system, no mixing is needed. 4. Apply Pain-Free directly to the sensitive surface with a cotton or foam pledget or a precision applicator for 20 to 30 seconds. 5. Simply dry with a gentle stream of air for 5 to 10 seconds. No curing light is needed. 6. Air test for sensitivity. If needed, repeat the application from step 2.